All right. So welcome everybody. I'm really happy to have this opportunity to get to speak to you tonight. And I'll get right down to business because of our late start. You've gone through a lot of clinical training and you're learning some really good techniques and you're learning some really good ways to take care of patients. And one of the frustrations that I hear from dentists that I work with is that they learned a lot of good clinical skills and they're frustrated because they need to get their team on board to help them get treatment acceptance so that patients could actually get the care that they need and you can do the type of treatment that you've been trained to do. So that's why I talk about the complete care dental team, because to get everything done that you want to do, everybody has to work together. So what I wanted to discuss with you today was this formula. And I call it the treatment acceptance formula because everything that we do is going to answer this question. And the question that it answers is how to get treatment acceptance. And it works like this. First, we have to know, first of all, and it starts with something simple. It starts with why. Do we know why the patient would want to move forward with treatment? If we combine that with the conditions that we see going on in the patient's mouth, along with understanding the implications of what happens when teeth aren't treated, along with a little test buy-in, it's very, very simple, that's, in my opinion, will equal case acceptance. And every dentist that I have ever met is always frustrated by the fact that, number one, they're not always certain what treatment to present to a patient, and they don't like the idea that they go through the work to have treatment accepted, and then a patient says no. And so we can work together with the whole team to avoid that happening. I want you to think of the treatment acceptance cycle as just a cycle, like a circular pattern. And it sort of looks like this. It starts why, and then it includes the conditions, and then the implications of not going through treatment. We have a short test buy-in, and then that's case acceptance. It goes like that. So there is a process, and the process starts with the telephone call, or any way that the patient is going to call your practice to get an appointment. And what we have to remember, and of course we go into a lot of detail about this in the course that we're doing later on in June, but the telephone call has to make sure that the patient feels like they're welcome to the practice. And it also creates expectations for the appointment, meaning they know what's going to happen when they get there. Because when patients don't know what's going to happen, that's where they start to get suspicious or perhaps distrustful of what's going on. Because you do things a little bit different as a Dawson dentist than most dentists might do in your community. The new patient phone call also creates curiosity about meeting you and what you're going to be like when they get there. So we have to remember that this is a really important part of the patient's process of accepting treatment, particularly if they're curious. Because if we explain to them what we're going to be doing when they get to the office, then they're going to be curious about seeing who you are. And when they're curious, they keep their appointment and they remember details. The next part of the cycle is they actually arrive at the office. And I know what you might be thinking already, like, geez, talking on the phone or arriving at the office, what does this have to do? What does this have to do with anything clinically? And it's, you know what? It has nothing to do with it. It has everything to do with how the patient feels about being a patient in your office. And it has everything to do with what the patient goes through to decide whether you would be the right physician or the right dentist for them. So I want you to consider, what image does your facility present to the patient? Is the front door clean? Is the reception area not cluttered with newspapers and magazines and things like that? Is the patient restroom, is it clean and organized with restock items? It seems like a small item, but we also have to remember that patients judge us by the things that they understand, not the things that you understand. So it's extremely important that we pay attention to what we say to them over the phone and what it looks like when they get there. People are not supposed to judge us by the way that we look, but we know that they do. So I say, let's not fight something that we can control. The next part of the cycle is the reception that the patient has when they come into your office. And what I would say to you is that patients should be greeted as if to say, welcome. We were expecting you. Patients don't expect to have to announce themselves. They expect that you're literally there standing at attention, waiting for them to show up. And so it tells us how we have to start organizing our day so that our treatment person, our treatment coordinator can be there to greet that patient when they come in. So they start to meet the staff. And the patient knows that the staff has a lot to do with how much the doctor is able to get done because they're going to help with billing, they're going to review fees, they're going to schedule appointments. And so the patient is looking at the staff very, very closely to determine whether they think the dentist is going to be able to fulfill all of their requirements. So I would ask you, do you have a designated treatment coordinator? Because that person should be there to greet the patient and provide them with a little tour of the office. That helps them feel more comfortable in their surroundings. It also relaxes the patient a little bit before they meet the doctor. I would also have the treatment coordinator provide what I call an administrative review. And this is where the treatment coordinator is going to review any additional paperwork or forms that you have the patient fill out, before they come to the office, make sure that they're all completed and signed. I also like the treatment coordinator to provide the patient with an idea of who they are and what they do. And I like them to explain that, I am the doctor's treatment coordinator. And what that means is I'm responsible for the doctor's schedule. If you decide to have any treatment done, you're not going to be alone. I'm going to help you along the whole way because I will review the fees with you. I will discuss with you the appointments that have to be set in the schedule. If your treatment requires seeing a specialist, I will make sure that you get to their office and that those appointments are coordinated. And so you're not going to be by yourself to figure all of this out. I'm here for you and I'll help you. So meeting the staff is a very important part to the patient. And we also want them to feel comfortable where they are. The next part of the cycle is that they do meet
Okay,
the doctor.
Laurie, can I have a question?
Sure.
Because we are not used to have treatment coordinators in Poland, I think there are in very few offices in whole country. So can the role of treatment coordinator can be passed to receptionist?
Yes, it is. And maybe I should have clarified that this doesn't have to be just one special person whose only job is just to do this. Even here in the United States, many offices do not have just a single designated person just to handle the new patient. It's a part of their other responsibilities. And often you're right, it is the receptionist. So even there, this responsibility can be given to the receptionist. What I want everyone to hear is that we don't want patients to ever feel like they're on their own to get their appointments and things explained to them. We want them to understand right from the beginning that there will be somebody to help them. We don't want them wondering about it while the doctor's examining them. Does that answer your question, though?
Yes.
Think of it this way. Somebody should have this responsibility. It doesn't have to be an extra person. We would never be able to afford that. So
yeah, but sometimes it can be also the dental assistant that knows the doctor, that works with the doctor.
Yes, it could be the dental assistant. It could be the receptionist. Most often, it's just one of those two people. You would have to have a very, very large office to have just one single person who handled these responsibilities. It's usually a part of everyone else's job. So we want the patient, again, like I said, to feel like, oh, good, there's going to be somebody here who's going to help me with all of this. And it's a part of their process because we know when they get confused, when they get stuck, because they don't know how to move to the next step, and there isn't anybody there to encourage them, they stop. And then they don't do anything, And then we wonder, what's happening? What happened to the patient? So they meet the staff. Then, of course, they meet the doctor and the hygienist. And that's when the doctor is going to do the dental examination. And what we teach in our course is that the dental examination has three parts to it. The first part is what we call the preclinical interview. The second part is the dental examination. And then the third part is the consultation. And every single patient has all three parts of this examination, so nothing is left out. The preclinical interview is just a time where the doctor is able to talk with the patient about their reasons for coming in, to determine, what's important to them about their oral health. Is there anything that they want us to provide for them? It just gives the patient the opportunity to talk. Now we have to remember, when the patient is given the opportunity to talk, it also helps them feel more comfortable. We also have to remember that many of us are dealing with patients who think they know more than we do. And because of that, patients who think they know more than we do, they're not good at accepting directions from people without providing their input. So the preclinical interview, it has a couple of reasons for it. Number one, to help the patient relax. And number two, to give the patient the sense that they're having their input. It's very, very important. Many of you probably realize when you try to tell somebody what to do, they just resist. And so we're trying to help the patient relax and lower that resistance. Then, of course, the patient would complete the accepted treatment that you provided for them. And then the final piece is what we call a post-treatment conference, where we review the treatment that we did for the patient. It gives us the opportunity to ask for referrals, because when we review the treatment that we did with the patient, they could see how wonderful it looks. They notice how much more comfortable they are, how much better they can chew. They notice how much easier it is for them to clean their teeth. We see that they're always very, very excited. And so if we let them know that we enjoyed treating them, and if they knew anybody who was looking to have dentistry done and they wanted to refer them to the office, why, gosh, we'd be happy to see them too. So it provides us an opportunity to ask for a referral, and then it also gives us the opportunity to get those after pictures. We're usually really good at getting before pictures because it's a part of our examination, but we almost never get the after picture. And the reason why I want you to have that is because patients want to see what you can do. They want to see, this is what somebody looked like before you started, and then this is what it was like when you were finished. And they want to be able to see the difference. So we want to be able to get those pictures. It's very, very helpful for the patient. So what I'm describing to you very briefly is there's a process that the patient goes through to learn that you're probably the person that they should get their dentistry done from, and that they can trust the staff to take care of them. So it answers all of these questions. So when we look at why, we have to remember patients accept treatment for their reasons, and they're almost never our reasons. Our job is to learn what is their reason. And so you can see now why I would want you to be careful about what you said to the patient on the telephone, because that provides us with an opportunity to learn a little bit more about why they'd be coming to the office. You can see now why I would want you to have that preclinical interview, because it's another opportunity for the patient to explain to us, this is what I'm looking for in coming to your office. This is what's important to me about my oral health. And I think you'll find that for most patients, there's usually about 3, maybe 4 different things that most people will answer. Many people will say that they just don't want to have any pain. They had family members whose teeth were painful and they want to be able to avoid that. Perhaps they want to be able to keep their teeth for a lifetime, chew better, or maybe look better. But I'm just anticipating that the majority of their answers are probably going to fall into this category. But it lets us know that if we recommend something and it doesn't help them solve their why, like the reasons that they came, then the chances are they're not going to accept your treatment. The next part of the formula are the conditions. And of course, that's why you have the exam. This process helps this formula because we all have to learn to recognize the signs of instability or the conditions that we would treat. And I know that you all know this as good Dawson dentists, but you're looking for wear, for loose teeth, broken teeth, cracked teeth, missing teeth, mobile teeth, bleeding, puffy tissue. I'm just giving some examples. Bulky or faulty restorations, overfilled teeth, chipped teeth, fractions. Um, it's important that not only you understand what conditions are present, but these are things that the rest of the team has to recognize as well. I know that they don't examine the patient. I know that. And other than the hygienist or the assistant, the business office is never, um, looking in the patient's mouth. But they do see pictures and they do see your chart notes because the conditions are what we look for because these are the things that are going to get in the way of what the patient is looking for. What I mean by that is if you had a patient who said, I don't want to have any pain, well, obviously, we're going to pay particular attention to conditions that we know will create a painful situation for the patient somewhere down the road. And so that's why we look for these conditions. We add to that the implications. And so here, the entire team has to be able to explain what the patient could expect if the condition isn't treated. And it's usually something simple, conditions like yours, Miss Jones, it leads to problems like. And I hope you're seeing that, wow, you're right. It's not only important for the dentist to understand signs of instability and the implications of not treating their teeth, the dental assistant has to know, and the receptionist has to know, because we know when the doctor leaves the room, who do they stop and look to? They look to one of those employees and they ask them, what do you think about this? And they have to understand that, well, Miss Jones, conditions like this lead to these types of problems. I mean, when teeth are cracked and not treated, they can break down the middle and cause the tooth to split in two, requiring a lot of additional treatment. So you see how that helps them? That additional treatment can be painful. And so they have to understand what happens or what can the patient expect if the treatment is not if the treatment is not accepted. Because beyond that, we do a little test buy-in. And this is an important part of this formula because many times we're nervous that we're not hitting the mark, or maybe we're not saying things that are important to the patient. Maybe we misunderstood, what was important to them. And so along with knowing why and understanding the conditions that are present and knowing the implication of not treating those teeth, we can stop and say, Miss Jones, does it make sense to come up with a plan to keep this from happening? Let's say, for instance, if you didn't want to have to spend a lot of money to go to the dentist, you want to take care of everything because you know how expensive treatment can be and you'd like to be able to save money. If I go back to the previous example, you wanted to save money, so I saw a tooth that was cracked. When teeth are cracked, they could split right down the middle and split it in two, which requires a lot of additional treatment and obviously expense. And to be able to avoid that, I'm wondering if it makes sense to come up with a plan to keep this from happening. I like this part of the formula. It's the test buy-in because it gives you an idea, well, am I hitting the things that this patient thinks are important? Because we don't want to write a treatment plan for something that the patient doesn't want to move forward with. Because when the patient agrees, yeah, you're right, I think it's a good idea to figure out, what's going on here. When they look at you and they say, yeah, that would make sense because I'm wondering, what do you think we should do? Well, when they ask, well, what do you think we should do? You're going to get case exceptions because now they're looking to you as an advisor. And they're not looking at you as some kind of adversary that they have to avoid or somebody whose phone calls they have to ignore. Because now they're asking you the question. And of course, a treatment plan that solves the patient's reason for seeking care, that's the treatment that gets accepted. We want to help people become as healthy as they want to be. And so that's why we spend time during our course to make sure that the cycle is implemented properly so that we can answer this formula. So it's y plus the conditions plus the implications along with a test buy-in, that's going to equal case acceptance. And so it doesn't have to be complicated. Each one of these pieces can be presented to a patient and can be taught to the staff. It's pretty easy to get started here. The conversation usually starts by saying, I noticed that a tooth is cracked. And, cracked teeth can split down the middle and cracked teeth can split down the middle and break the tooth in two, requiring additional treatment. I brought this up because I recall from our earlier conversation how you wanted to keep dental expenses to a minimum. So does it make sense to discuss options to save this tooth from breaking any further and preventing additional treatment costs? So I put this example together because it's all based on what this patient wants to do. Now, you're a dentist, so you may be thinking, well, wait a minute, I've got to bring up everything that I see going on in their mouth, not just the things that the patient wants to talk about. And what you're saying is true. It is your job to diagnose every condition, but when you do that, it's also important for you to find out from the patient, how do you feel about what's happening to you? Many times, people who think they know more than you, they have an answer. They go, I don't like this. And if you ask them, what do you think should be done about it? They sometimes have an answer of their own. So now you're in a communication with the patient and you can ask them, so it sounds like this makes sense to move forward and take care of this problem. But it doesn't have to be complicated, and you don't have to worry that you're not moving in the right direction. You know that patients are only going to accept the treatment that they want to accept, so long as it's for the reasons why they were seeking care. So there are some steps to get started, and there's 10, and I'll go through them. And these are things that you can actually start to do tomorrow, believe it or not. You can start tomorrow when you go into your practice, and you can get this cycle to work for you. Some special promotional fees that they have. But we're looking forward to seeing you on June the 1st and 2nd. So to get started, number one, you have to be very clear about the philosophy of care for your practice. Don't be ashamed of what's important to you. If you want the bite to be stable, if you want teeth to be cleanable, if you want them to look good, whatever it is that is your philosophy, know what that is. And the reason why I say that to dentists is because you will attract what you become. If you become known for going by the book, if you become known because you don't skip steps or cut corners, then obviously you're going to attract people who think going by the book is important as well. And if that's what you want in your practice, then adopt that as your philosophy. But know the philosophy of care for your practice. It seems silly, but it drives all of your decisions. Because the next part of the step is that you've got to teach this philosophy to the staff and to each other. You would think that because your staff worked with you, they knew what you treated and when you thought it should be treated. But just like those signs of instability, many times I find that staff members don't quite understand what creates a problem in a patient's mouth. And so you want to be able to teach this philosophy to your staff so that they understand. Again, we know that when the doctor is through, a patient will take a look at a team member and say, well, what do you think of this? And that team member has to be very confident that, yes, when you have problems like this, it leads to conditions like that. And if it's left untreated, well, gosh, that tooth could break all the way. And I don't know what it would be like if you lost it. You see, if they can answer those questions very, very quickly and very, very confidently, it's extremely reassuring to the patient that they're making the right decision. I'd also go so far as to say that this philosophy of care, what you treat, what you don't treat, what's stable, what's not stable, this philosophy also has to be taught to the hygienist, because it's very important that that person understand how to keep this patient's mouth healthy. We also know that the hygienist is going to be treating the patient in the future after this examination. And if things change in the patient's mouth, we want them to recognize, hey, we're seeing something now that we didn't see before or wasn't present before. And, these are the types of things that create pain or keep you from chewing properly, whatever their reasons are. And so that's why I brought it up. But then we can find out where they're going. The next step is to establish performance standards, because to get all of this done, not only do you have to have business office staff that know what they're doing, you also have to have dental assistants, hygienists, and the doctor. And so each one of them need to know how to do their job. And so what I would always recommend is a position description that lists out all the tasks that are there that need to be done. And so you can establish the standard for how this work is done, about how they answer the phone, how they scan or pour up models, or even how they clean teeth. You set the standard for it. When you set the standard for the employees, for the team members, you can then begin to determine training needs. Because when you really start to think about what you want each employee to do, you'll learn whether the employee knows how to do it or not. And I don't think that that's a problem if the staff member doesn't know how to do it, because now we can create a plan to train that person. We're lucky in dentistry. There's almost nothing that you need them to do that they couldn't learn. And so we'll train them. And so knowing what those standards are, knowing what each one of those tasks are, will help us determine whether they need some help in a particular area. The next step is to provide regular follow-up. I think a lot of times as leaders, we let people know you need to do X. And then we just assume that it's being done that way, only to find that they didn't quite understand what you said and they haven't been doing it. And you know as well as I do that they usually don't find out, or you usually find out that they're not doing something when something goes wrong. And so we want to train them that they need to look for these things so that they find out before you do. So you have to provide regular follow-up. And it's a part of the reason why we talk about some very specific meetings that you should have with your team, so that you can always be assured that you've got the right materials, the right equipment, the right tools, that everybody has everything that they need, so that when a patient is scheduled, you can walk into a treatment room and it's mask on, gloves up, and you can go to work. So you have to provide regular follow-up with team members. And don't be surprised that you're constantly refining what you're doing, because your techniques constantly get better and better and better. And so as you take new classes, as things become more clear to you, as you develop new techniques, as you buy new materials, new technology, it changes the way your staff does their job. And if they're always left on their own to figure out how to get things done, well, they're not going to feel good about that. You want to provide regular follow-up to let them know how they're doing and where they're going to go next. The next part of it is to make them demonstrate the process. Again, all too often, I think we tell staff members, well, go ahead and do this, and you assume that they know how to do it correctly, only to find out that they didn't understand. And so if you're doing something like scanning, I would scan a model, and then I would let them scan a model. And the two of you could do it together when you're treating a patient. And when you see that their scan is adequate and done correctly, then you can stop doing it and you'll use theirs. And so you have to make them demonstrate the process. Often I find that there's one small item in the task that they're trying to accomplish, and just that small item is throwing everything off. And if you make them demonstrate the process, you'll probably catch that one item that isn't listed in the instructions, but it's something that you knew over time it was necessary. So make them demonstrate it. The next part is what I would say utilize block scheduling. We do go into particular detail about this but in our course, but what I'll say to you tonight is that block scheduling is about reserving time for certain types of procedures. And so since we're talking about treatment acceptance and the new patient, I will say as an example, I would utilize block scheduling to reserve a very specific time for that new patient to come in. Think of it this way. When a new patient comes in, they expect you to be ready and on time. And so in order for you to be on time and ready to go, I think you better look at your schedule to determine when's the best place for that. You know, many dentists will tell me once they've started the day, they're not always ready and they're not always on time. And so they wouldn't want a patient coming in during the middle of the day, but they would reserve a specific time. Think of the person who works at the front desk, your receptionist. If you want them to be ready to greet that patient, to stand up and say hello, to make them feel like, hey, we were expecting you, that means they can't be doing other things when that patient arrives, because you want them to be able to get up and greet them right away. So if you block a time in the schedule, then you always know, say if it's 1 o'clock in the afternoon or 2 o'clock in the afternoon, we're going to see our new patient. Well, now they develop a pattern of behavior that, you know what, every day at 2 o'clock, here's the new patient. And so now I think you can see why what we say to them on the telephone is so important, because it helps guide people into those blocks. It also helps you be more efficient in delivering your procedures. But for tonight, the example that I want to give you is just utilizing block schedule would be a way of reserving a specific time for new patients. It helps them to be seen right away, and it assures that they won't be there longer in your office than you planned. The other thing I'll say to you is that if I'm doing things here correctly, is that it's actually through your examination that you gain treatment acceptance, because that's where you pull all the components of the treatment acceptance formula together. You know, that's where you discover the conditions that you know will create problems for the patient down the road, you know, and so that's why you can tie it back into, you had mentioned to me that you didn't want to lose any teeth. And when I saw that this one was broken, I knew that if it wasn't treated, there's a good chance that you could lose this tooth altogether. I mean, I only brought it up because you had mentioned in an earlier conversation that you didn't want to have to lose teeth like perhaps a grandparent did. So I'm wondering, you know, does it sound like maybe we should sit down and come up with a plan to keep this tooth from, you know, breaking any further? You'll get your answer from the patient. And if what you're doing is helping them get what they want, that's when the patient actually looks at you and says, well, what do you think we should do? Well, I look at that as the sun, you know what I mean? The clouds have parted and the sun comes through, and now they're looking at you as an advisor and not an adversary. So the examination is something that we go over in a lot of detail during the course to make sure that all the components are there, because that's where your treatment acceptance is actually going to come. I do believe that patients make up their mind very, very quickly about whether they think they should accept treatment or not. The ninth thing is that when you're starting a new process in your office, a lot of times offices will tell me that they're reluctant to start on somebody totally new. And so they think that it would be more comfortable for them if they worked on somebody that they already knew. And so I teach them to identify existing patients to reevaluate. What I mean by that is there may be several patients in your practice right now who maybe never had a comprehensive oral evaluation from you, or perhaps it's been a long time since they've had an evaluation and things are changing in their mouth and you're finding it difficult to hold them together. The hygienists are very, very good at identifying who these individuals are. And so I would say before you start each day, take a look at your schedule and see, are there patients who are coming in today who would benefit from a reevaluation? And what I mean by that is another examination by the doctor. And I find that these reevaluated patients are a very good source of new exams for you. And it gives you another opportunity to sit down and really talk to a patient while they're prepared about their treatment. So don't forget about existing patients who are already there. We don't always have to rely on a new patient coming through the door. It could be an existing one that's already there. And then finally, pay attention to what your results are telling you. There's some very, very specific numbers that we look at. And again, we talk about this at the course, But what I would tell you this evening is that are people getting healthier? Meaning, are they breaking less teeth? Are they getting less gum disease? Are they reporting to you that they're not having as many headaches? So pay attention to what your results are telling you after you've treated your patients. Because if you see that I treated them, or I see patients that have wear in their teeth and I don't know how to solve that problem, then it lets you know, well, that's something I need to learn. And I don't want to always sound like I'm plugging the Dawson Academy, but I think you're aware that this is a great resource for all of you to learn how to solve patients' problems. Because another thing I'll say to you is that when you develop a reputation for being the dentist in your area who can solve patients' problems, you will lead patients to your door and they will tell other patients about you. So pay attention to the results that you're getting. And so I wanted to review with you today this treatment acceptance cycle. It's what we review during the course because it answers the formula for you. And when we put it all together, it's more than likely the patient is going to accept treatment from you. So those are the things that I wanted to discuss with everyone tonight, Perry. And then if there's any questions that they have, I'm happy to stay here and answer questions for as long as it takes. Because we're certainly okay.
Okay, can you hear me now?
Yes, I can hear you.
Okay, perfect. So the thing that I wanted to say is that the thing that you said, it's great. Most of us know it, but only few does it.
Actually do it. And so that's why we're so careful to go through each one of these steps during the course, because we want them to actually do it, because it helps them implement the treatment that they're learning.
So do you have any tip how to make it work for like business owners, for the dentist who owns the business?
Well,
follow up of their thing they are doing.
I'm sorry, I didn't hear that last thing that you said.
Okay, so the special checklist for us, for business owners.
I could give you an examination checklist that would help you, for the exam, if that's what you're referring to.
Okay, no, I'm just my question was about something else, about 10 points to achieve a good consultation. And you were talking about the things that receptionists should do, that we should do. And sometimes we know it, but we forget about it.
Okay.
So what's your tip to not forget?
Okay. So my tip would be that you first sit down with all of your staff first. Sit down with them and review each person's role and say, the receptionist, what will you do when the patient calls? What will you describe to them? And what will you do when the patient comes in? So just review that with that person. Have a little planning session about it before the patient comes in. And then review the examination process with your dental assistant so that they have all the materials prepared and they know what pictures you want to have taken, what x-rays you think are necessary. So review that with them. And then the other tip that I would give you is when you're presenting treatment to the patient, when you're presenting treatment, going over your recommendations, I would always make sure that this person who has responsibility for coordinating treatment is there. And so don't leave them out of the process because a lot of times they don't always know what's going on and they find themselves sort of caught in the middle because they're talking to the patient about getting the appointment scheduled and the patient will say, well, the doctor didn't say that. And now this person doesn't realize, well, I wasn't there, so I don't know what the doctor actually said. So a really important tip is I would say ask the treatment coordinator to be present when treatment is going to be recommended. And so I think if you just had a little planning meeting about it, then everybody would feel comfortable with the process.
Okay, thank you very much. And the next question is so if new consultation, when the patient calls, should be the same day, or the patient can wait for it?
Oh, that's another very good question. I don't want to throw logic out the window because sometimes it's not convenient for the patient to come back for a consultation if the treatment is simple. So what most offices tell me they do is if the treatment is usually just maybe 1 or 2 procedures, like perhaps they need some fillings and they need gum therapy, then they would go ahead and present the treatment to the patient that day. Because I think everybody would agree that that would be overkill to send them home and make them come back just to say that you need some fillings and gum therapy. But what we find is if it gets more complicated than that, like for instance, maybe they need a bridge and gum therapy and or an implant and gum therapy and some fillings. Now it's starting to get complicated because you've got specialists involved. Usually I find that it's best to have the patient come back. A lot of times there's other people who will help them make this decision, maybe a spouse or a relative or something. So now this person can actually come with them. It's also easier for the treatment coordinator to be present when this happens. So if I'm making any sense here, if it's simple and it doesn't require a lot of thought, and if the person isn't having a lot of problems, you'll probably have time that day to go ahead and present the treatment. But when it starts becoming more complicated and taking multiple appointments, then I would say don't rush, let the patient think about it and have them come back. So the doctor always decides, will I do this today or will I have the patient back? The person who helps coordinate treatment sort of has to be on standby. So usually the dental assistant knows, oh, this is complicated. He won't be, presenting treatment today. This patient will need additional records. And so their next appointment will be for records, and then we'll have them back for a treatment presentation. Does that answer your question?
Partly yes, but the question was a little bit about when the new patient calls, and should we get him the same day for consultation, for the visit to the office, or should the patient wait?
Oh, I see what you're saying. I think that's one of those things where I don't want to throw logic out the window. If this patient is reporting that they're having a problem, and something is uncomfortable for them, then I think you would want to get them in as quickly as possible. And I think that that's okay. If they're not reporting any problems or anything that requires any urgent care or anything like that, I think it's okay to wait and have them come in the next day or two. I noticed today that there is a big rush to get people in right away because we think that if we don't, we'll lose them. But you have to remember for the patient, it is a process. And it's a process of learning that you're somebody that they can trust. And so we don't have to rush it. If they're curious about who you are and what it'll be like when they come to your office, those people get committed and they'll come in. So have I been able to clarify though and answer your question?
Yes, thank you very much.
Okay, I'm glad.
And the next question is how to explain to the patient when we need the next examination of the patient that is in the treatment process.
Are you referring to the additional records, the diagnostic?
Not additional one. So if we can imagine like situation, we started the process and the patient is in the treatment plan.
Okay.
Once we done like 5 months ago, and we went for the hands-on. We got new knowledge, and we need a new examination to treat this patient better. How to explain?
I would say to the patient, I'm seeing some things now that weren't here before, and so I would like to take the time to examine you again. I would treat that like a reevaluation. I just see some things going on that I would like to address, and I need to study it further and have you back so that I can take another look in your mouth and sit down and talk to you about what I'm seeing, because I want to be able to show it to you. I guess what I'm saying here is just be honest with them. I'm seeing things, now that need to be addressed. And so I'd like to have you back so that we could look at it together.
Yeah, I think it helps a lot that because we've done this like 10 years ago with all patients. And there was the way you said it. We've done the same thing, and it works great.
Right, because I would also say that if it's been 10 years since you've examined this patient, I think it's truthful to say, there's things going on in your mouth, 10 years ago that we didn't know how to treat. And now I've studied these things and I know how to treat them. And if you'd like, I want to have you back so that I can examine you again and you and I could talk about how to solve these problems. Because it was true, years ago we didn't know how to solve some problems that patients have, and because of it they would just lose their teeth. But now we can save them.
Okay, thank you very much. I've got one more question.
Okay, good group.
Thank you. The question is about the receptionist, because sometimes people believe that they should greet new patient with the name, and some people believe that new patient should be greeted like no name, no like, and I think you understand what I mean.
I think so. I'm a name person. And I think if you have, let's say, a female's name on your schedule, and a female walks in the door, even if you don't know who that person is, I would err on the side of, are you Mrs. So-and-so? Because you'd be our new patient today. And even if you're wrong, that person would say, no, I'm just a sales rep. I'm trying to sell something. You can say, oh, well, okay, because I'm waiting for so-and-so. But more than likely, that patient's going to be coming through the door at that time. I would err on the side of using their name. Some people are confused. Should I use their first name? Should I use their last name? I like to, even though people are very casual today, it's easier to start with, Mr. Guzzardo, it's so good to see you. We were expecting you. If I prefer to be called Larry, then I'll say, oh, no, you don't have to call me Mr. You can call me Larry. And then that person would correct you. So I think it's good to try to use their name.
Thank you very much. So I've got next questions because I found that we have many similarities between states and Poland. And one thing that is different, that the relation between a patient, receptionist, treatment coordinator, and the doctor are closer in states than in Europe. What do you think about this?
I think that they all could be closer, because I think it's important for the patient to feel like they have an advocate at the office. And so that's why I like the person who has the responsibility for coordinating treatment to actually start to bond and become friendly with that patient, because patients know they need help to get all of these things done. They have questions that have to be answered. There's fees that need to be discussed. They need to figure out how they could pay for it. They're specialists. And so we want them to feel very, very comfortable working closely with this person who's responsible, for these duties. We also know that patient should feel comfortable calling the office at any time that they have a question. And if only the dentist can answer those questions, then we're going to have a problem there, and we're going to have a delay in treatment, because it might be a whole day or a week before the dentist can do it. So I'm happy to hear you say this, because I'm coming there to talk to you about these things, because I feel like they could have a closer working relationship than what they might have right now. And I think your receptionist would enjoy her job better.
We are trying to make it like
That's
closer. Okay, so I've got one question because you said about presenting a treatment plan. Are there any differences in presenting small treatment plan for like two fillings, gum treatment, and big treatment plan like implant case, veneers, bridge?
I don't think there's anything different that needs to be done. The process would be the same, where you always would want to sit down with the patient to review, why they came in and, what was important to them. Then you can discuss what you found when you looked in their mouth, and that to solve these problems, these are the things that need to be done. And so really the process is exactly the same. And what makes it work is that we're always presenting treatment that helps the patient achieve what they were looking for, whether to be more comfortable or not have any pain or anything like that. But the format obviously is shorter when there isn't as much treatment necessary, and it's a little bit longer when there's additional treatment. But the process is exactly the same. I wouldn't want you to feel like you had to change what you did.
Okay, perfect. Thank you. And the last question. When you have a patient with the big complex treatment plan, so is it better to sell it piece by piece or sell it in one big block?
See, this is good. And now I think you can see the value in the examination, because part of what we teach in the course is that when you're examining the patient, you're also finding out from them, how do you feel about what's happening to you? Has anyone ever talked to you about this before? Um, uh, you know, you're asking them again, how they feel. Has anyone ever described this to them? You're going to start to get an idea of what they want to do, because I promote that you would explain everything to them right in the beginning. These are all the things that we see breaking down in your mouth. And based on what you've told me that was important to you, these are my recommendations for taking care of your problem. Notice I didn't talk about where, because you told me that right now you didn't think that was important. So maybe I left that out. But you do have teeth that are worn. And whenever that becomes a concern to you, we can talk about what treatment could take care of that for you. So I find that patients become very suspicious when every time they come into the office, the dentist finds something new that needs to be treated that they weren't aware of before. If I'm making any sense, I'm listening to that patient very, very closely. I'm addressing the things that they have asked me to address, but I did not ignore the signs of instability, because I am talking to them about it. I'm just willing to wait to make recommendations until they come in, until they say that they want to talk about it. So I would present everything.
Thank you. That's how we do it every day and for like 10 years, and it works great.
I knew I could get you to go by the book.
And the thing that you told about the examination, that what I can say about our experience, when you do it right, the patient says that they were never ever been examined the way that we do before. So that's one of the most important treatment factor and marketing factor.
Yes.
Because
and so maybe now they can see why it takes the whole team to get it right. Because the patient looks to everybody for reassurance and encouragement.
Yeah, so and we give, I don't know how much time it takes to have a first consultation in the US, but we spend with the patients like almost 2 hours for the first consultation and examination.
Yeah, that's very, very typical. That's very typical. Depending on whether they're going to take records that day or not, it probably will last anywhere from an hour and a half to 2 hours. I'm finding everybody's different, and it works both ways. Some like to take, if records are necessary, the additional records that you teach, the face bow and the bite registration and all the other pictures and all that. Some offices find it more convenient if the patient wants to go ahead and do it today. We've got time on the schedule, we'll get it done. Other offices feel like they'd rather have the patient come back and make that the next appointment. But I find it works either way. If the patient's ready, you can go ahead and do it. And so it will take probably an hour and a half to 2 hours.
Okay. Larry, I think we don't have any more questions. So thank you very much for the time that you spent with us. I will say something in Polish. No? Okej. Mam dla Was, chciałem Wam bardzo podziękować po pierwsze za to, że byliście z nami. Przygotowaliśmy dla Was specjalną ofertę, bo Larry będzie razem z nami też w czerwcu. Dla wszystkich osób, które były na dzisiejszym webinarze, jest specjalna cena. Jest kopromocyjny webinar, trzeba go wpisać po prostu w odpowiednim miejscu. Gdyby ktoś z Was miał ochotę uczestniczyć w tym seminarium.
Yeah, okay. I'm sure I told them how much fun I am.
You did great. Like an hour, no PowerPoint. You are great. I think there is very few people who can do it.
Well, thank you. I'll take that as a compliment because I know you've given quite a few presentations in your time. But no, I'm looking forward to our weekend in Poland, and I'm looking forward to seeing everybody. And if anybody has questions before, you can let them know that they're welcome to send you the question, and you can forward it to me. And I'm very, very happy to answer those.
Okay, Larry. Thank you very much. Have good. It's even not evening. We are having a night now. And see you soon. Thank you very much.
Thank you.
Bye.
Bye-bye.